Hello everyone, I hope everyone's staying healthy and safe, and welcome. Today we will be discussing, in this presentation, the very prevalent viral infection known as hand, foot, and mouth disease, completed by myself, Stephen Abishary, and the lovely Tegan Connolly. Let us begin. First and foremost, the abstract, which briefly entails what this presentation will be about, which is that it is an insightful and in-depth presentation on hand, foot, and mouth disease that goes over the various aspects such as what causes the disease, the symptoms, treatment, historical significance, and more. Now let's get into the details. First and foremost, what is hand, foot, and mouth disease? It is a viral infection that causes sores at the mouth and rashes at the hands and feet. It is very common in children, most commonly in under 5-year-olds, but can happen to anyone, including fully grown adults. It must be taken seriously in every sort of occasion. It is very common during the summer and early fall months, and specifically in the U.S., and it's known to thrive in warm and humid conditions. Now, there are a series of viruses connected to this disease, and these viruses are a part of the entovirus family. The first is the Coxsackie virus A16, which is the most common case of hand, foot, and mouth disease found. The next level up is Coxsackie virus A6, which may have some more severe symptoms and a little bit harder to treat. And the most severe form is known as the enterovirus 7-1, also known as EVA71, which can be associated with more severe diseases and can cause very dangerous complications if left untreated, such as encephalitis. Now, here are some of the symptoms with this disease. These symptoms include, in the most mild case, fever, sore throat, sores on the mouth, loss of appetite, and skin rashes on the palms and hands and feet. Now, these symptoms will most likely last for 7 to 10 days when having the disease. Now into another important section, treatment. Now, a very, very key detail when discussing treatment is to know that there is no cure for hand, foot, and mouth disease. This is due to the infection being caused by a virus, and that means that antibiotics will be ineffective in helping cure the disease. It usually takes 7 to 10 days for the infection to go away naturally. So, in more minor cases, patients will be more or less somewhat on their own. Now, there are ways of going about treating this disease to help ease the discomfort while going through the process of waiting out the condition. Some of these methods include over-the-counter pain relievers, not aspirin. Aspirin has been found to not help with the pain of hand, foot, and mouth disease. Drink lots of fluids to avoid dehydration. Avoiding dehydration is a key detail to beating this condition while riding out the cycle. Other things include anti-itch lotions such as calamine to help with the sores on the hands and feet, and to drink cold food and drinks to soothe the sore throat and to help not irritate or agitate the sores inside the mouth. And avoid drinking juice and soda, as those can directly irritate those sores and the sore throat. Now, if this cycle goes through and it doesn't pass, that is the time to see a doctor. However, there are other cases to go see a doctor. For example, if the child has contracted hand, foot, and mouth disease and is younger than 6 months, this makes this child extremely vulnerable and should be taken to a medical professional. If dehydration occurs, which in any case, can lead to a slippery slope of much more serious side effects and complications, which can be stopped, however, if you receive the proper medical attention. And finally, if the patient has a weakened immune system, which can be caused by any sort of other condition or virus or any sort of situation where a patient has a weakened immune system, does not have to be directly connected to hand, foot, and mouth disease, but regardless, if in any case a weakened immune system can mean extreme complications and proper care should be sought. Now for some historical context. Hand, foot, and mouth disease cases were first described clinically in Canada and New Zealand in 1957. It wasn't named hand, foot, and mouth disease a couple years later by Thomas Henry Fluett, who was the founding member of the Royal College of Pathologists, and he named the disease in 1960. in the modern world today, the disease known as hand, foot, and mouth disease is very, very common in China. And China has had a recent outbreak history in the last 20 years with this disease, starting in 2008, where they only saw 25,000 cases and only 42 deaths. It has showed, even with the passing of times and what would seem to be more modern medicine, the disease seems to have ramped up and caused deaths in the hundreds, and in 2012 reached its peak with 1,520,000 and 274 infected cases and 431 deaths, making this a very prevalent disease inside the country of China, and one that needs to be taken seriously. Now for the significance of this disease. First and foremost, it should be known the significance of the level of contagious that this disease is. If you have this disease, especially children, they should be isolated and kept away and allowed to quarantine for the 7 to 10 days needed for this disease to run its course and pass through. This is very important due to the level of spreading that this disease can cause, and it may be able to catch on to someone who isn't quite able to handle it, and that can have serious complications. This disease, further into complications, while this disease itself, in its most basic form, is not very serious, untreated can become much worse and can even lead to death. And it's important with just not only this disease, but any disease, to be properly informed medically on how to treat it and allow it to not become any worse. Factors that can contribute to the spread of how contagious this disease is. It's more common in younger children and often found in daycare facilities and schools, and can be transmitted by nasopharyngeal secretions such as saliva or nasal mucus. And other factors that include this are poor hygiene, coughing or sneezing, and not covering your mouth or nose, close contact like kissing, hugging, sharing cups or sharing utensils, or contact with fecal matter, like for instance when changing a diaper, or simply coming in contact with the virus on a surface where it is currently infested on a microscopic level. Now, this disease prevalently in China can have socioeconomic impacts. Now, in the most minor cases, it was found that children will run the course and be able to come back to school totally fine, and parents are able to go back to work. However, in more extreme cases, such as, for instance, in EV-71 cases, many parents and children are missing days from school, but more importantly, parents are missing days from work. And not every social class is able to afford these long days away from work. Now, while diseases don't know social class, income does, and missing these days can have serious negative effects on a household, which is coupled with the cost of treating the disease, which even in its most minor case had an average of $208 to treat, which can only go up to more severe cases. And it was found that it cost $7.66 million to treat a population of 1.42 million children annually in 2015. These two factors, social and economic, go hand in hand and can have serious devastating effects on certain households and families that have to come across the worst forms of this disease. And just beyond the social and economic level, the consequences and complications of not treating this disease can become very, very serious. This includes dehydration, which will leave someone very weak and unable to receive the proper nutrients due to being very weak and not intaking water properly. It can even cause you to lose finger and toenails around the areas where you had your rashes on your hands and feet. It can cause viral meningitis, which can further make you even more sick and cause you to lose more time away from people you love or away from work, which just is more time in bed. And then which is never good. And then you get into the more severe cases, which is known as encephalitis, which is known as a polio-like paralysis, which is one of the most devastating effects. And of course, the worst by far, death. All of these cases should be taken seriously and to receive the proper treatment to avoid any of these things happening. Now, what we know today is that the CDC has a vaccine known as the EV71 vaccine, which is able to prevent hand, foot, and mouth disease in China as early as December 2015. In the U.S., however, the National Center for Immunization and Respiratory Diseases and the Division of Viral Diseases are still working on develop vaccines to help prevent this disease at all from happening in the future. That being said, even without the proper vaccinations, there are plenty of ways to help prevent this disease from spreading. These include washing your hands, using clean surfaces and to disinfect them regularly, avoid touching your nose, eyes, and mouth, avoid close contact with those who are sick, and do not send a child back to school or daycare if symptoms are resolved. Also, to help going further in detail with children, teach them to sneeze or cough into their elbow to help avoid spreading the virus onto surfaces all around the school area. And tell them not to share cups or utensils with anyone that may have hand, foot, and mouth disease. Here are our sources. Thank you for listening to our presentation. I hope everyone has a great day. Continue to stay safe.